Hello everyone, welcome to sqadia.com. I'm Dr. Hamna Iftikhar and today's lecture regarding gastroenterology is a very interesting topic which is called as the feeding and eating disorders. So you all would be knowing about some of the feeding and eating disorders. It might consist of anorexia nervosa and it might consist of bulimia nervosa. So eating disorders usually is a mental illness that is characterized by the disturbance in the body image, the weight, and the dietary patterns. So these usually patients they usually have chronic malnutrition. They might be overweight and they might be having purging behaviors that might risk and might develop into complications that can be very serious and can be very fatal. So these patients, they usually, the patients with anorexia nervosa and bulimia nervosa, they usually have a very high risk of mortality. So we'll be talking about that in detail in this lecture. So this is an outline of the things that we will be studying today in this lecture. Starting off with the gastrointestinal abnormalities, we'll be talking about the symptoms that usually patients present with. If a patient comes up into the outpatient department, they usually come up with some gastrointestinal sign and symptoms before the symptoms of feeding and eating disorders. So these symptoms, they come on the top of the list. So we'll be talking about the feeding and eating disorder, the gastrointestinal symptoms associated with the weight loss and food restriction. There might be gastric necrosis, there might be early satiety, constipation. And then we will be talking about those feeding and eating disorders that are associated with purging and refeeding behaviors. So, what are the symptoms that these patients present with? They might present with bloating, diarrhea, and delayed gastric emptying. And then we'll be talking about the management of eating and feeding disorders. As we all know that these patients they are supposed to be treated in a multidisciplinary team. So these patients they come under the doctors that could include clinicians, they could be dietitians, and they could be mental health clinicians. So it's a multidisciplinary team that puts in an effort to treat these patients with this mental illness. And then we'll be talking about the management of eating disorders on the basis of psychiatric treatment. So there's a list of psychiatric treatment, that is psychotherapy and pharmacotherapy. So there's the list of psychotherapy that includes CBT, IPT, and family-based therapy. We'll be talking about that in detail. And then the pharmacotherapy, what are the drugs that are involved in treating these patients with the mental illness? So what are the psychological drugs that are given to these patients, that are offered to these patients, and what are the outcomes? We'll be talking about in much detail. And then we'll be talking about the foremost important thing in treating the patient is the weight management. As patients with anorexia nervosa and bulimia nervosa, they usually have a very, very low BMI, and the expected body weight is usually decreased and it's below 75%. So the cornerstone of the management is the weight management. So it's very necessary to recover the weight, recover the the nourishment that they have lost, and we'll be talking about that in detail. And then we'll be talking about the refeeding syndrome that these patients usually complicate into. So how to assess and how to monitor these patients. So this is all that we'll be talking about in this lecture. We have a lot of lectures on our website regarding cardiology, gastroenterology, medical and surgical lectures. So you can subscribe to our website right now. And if you want to have a free trial, you can also log into our website and have a free trial today. So we've got thousands of lectures. Do watch some of other of these lectures, and thank you for watching sqadia.com.